Welcome, everyone. This is Mayor Steve Haggerty, and you are joining our Evanston coronavirus Q&A session that we've been having periodically since around April of 2020. Our year is quickly closing, and I think it's a year that we all want to put past us. But as we close the year, there is some positive news on the horizon about vaccinations with COVID-19. I'm pleased today that we have as our guest Dr. Rick Hubbard. Rick and I go back to our days serving on the board of Youth and Opportunity United, a wonderful youth development organization here in Evanston. And Rick has a really interesting story that was shared in the Evanston Roundtable a couple weeks ago that I thought is related to vaccines and should be something that we talk about today. So I'm pleased to have Dr. Rick Hubbard with us. We also have with us Ike Ogbo, our Director of Health and Human Services here in Evanston, who has been doing a terrific yeoman's job with his entire team to try and keep us all safe here in Evanston. On that note, I do want to quickly run down with everyone the numbers and where we are here in Evanston. As everyone knows, the numbers have been rising across the entire United States, including in our state of Illinois. The governor has taken mitigation measures to reduce the amount of activity that we all have. I know that is not easy for all of us, including our children, but it is so far showing an effect, and we have been able to at least not see our numbers increase. And so we're anxious to see where those numbers go this month, particularly given that we just had Thanksgiving and we're entering into the holiday season with Hanukkah coming up and Christmas and other holidays. So where we stand right now, our region, which is Region 11, EMS Region 11, our positivity rate in the region is 12.7%. Evanston, and that's our 7-day positivity. Evanston's 7-day positivity right now is the highest it has been in recent months, and that is at 8%. So we clearly are seeing our positivity rate go up. It is still below the state average of their 7-day positivity. We still, on a comparative basis, in terms of the number of cases per 10,000 or 100,000, are continuing to do well relative to our nearby neighbors in Skokie and the city of Chicago. Lots of people are concerned about hospital capacity right now because of the rise in cases. They've set a threshold of wanting to have 20% availability. We are below that in our region for ICU beds right now, and we're just about 20%, a little above 20% for medical beds. The good news right now over the spring is that the medical profession has developed more knowledge about this disease, better techniques to treat people. But still, we have too many people that are dying of COVID-19, including 88 deaths to date here in the city of Evanston. Our infection rate, which is the rate in which a person with COVID-19 infects another person with the virus, is at around 1.0 right now. So a person with COVID-19 is affecting one other person. We want to see that at 1.0 or below. The lower, the better. It means we have a better handle on the spread of the disease. The 7-day moving average, case average, for Chicago and Cook County has been decreasing. I will say right now the Evanston 7-day average is pretty high for Evanston. It is 32 cases is our 7-day average. Now, we had one of our highest cases about 7 days ago, which was 63 cases here in Evanston. So that's still part of the calculation. After today, I believe that moves out. So we will probably see that 32 cases a day on average for the last 7 days drop down. My guess is to around 23 to 25 cases. As I mentioned, our 7-day moving average is at 8%. And let's see, the last thing I want to leave you with, I mentioned the hospital capacity. So our hospitals in this area still continue to have capacity in terms of ICU beds, in medical beds. And that's both Amita St. Francis Hospital on the south side of Evanston, as well as our North Shore University Health System, which is Evanston Hospital, and then Glenbrook Hospital has been the one that has really been the COVID-19 hospital for the North Shore system. And lastly, I just want to leave you with our long-term care and our congregate facilities. These are the facilities we worry about the most because they have older Evanstonians living there, generally over the age of 60 or 65. And in the last week, we've had 22 staff cases in those congregate facilities and 36 resident cases. The big uptick in those cases actually hasn't been the senior living centers, but some of the other congregate care facilities that we have in the community to care with people who have other challenges. So that's a quick rundown on where we are. Again, today's topic is going to be on vaccines. I do want to caution the audience, and this is being broadcast live on Channel 16, Evanston's public station, as well as on Facebook Live. I do want to caution everyone that as much as we want to have concrete information on vaccines, we're still waiting. There's a lot moving. There's a lot going on. There's a lot of different authorities involved, from the Centers for Disease Control to the Illinois Department of Public Health to our own local health department. So we are going to try to answer your questions today, but I do ask for patience and understanding that we may not have the answers yet to some of these questions. But just trust that we are very much working closely with these other authorities, the CDC, Illinois Department of Public Health, to understand when we may be receiving these vaccines and how we need to think about, who's getting these vaccines first, second, third, and how we would actually distribute those vaccines. So Ike Ogbo is going to help us today on those questions. So let's go ahead and get our panel started. First, I want to turn to Dr. Hubbard and just ask, Doctor, if you would share your background with our community. Because I think it's a really interesting and relevant background to what we're going through right now, as well as how you came to participate as one of the trial participants in the test for these vaccines. Welcome, Rick.
Thank you, Doctor. Excuse me, Mr. Mayor. It's a pleasure to be here and share my experiences with the Evanston community. I'm a research physician. I worked for 30 plus years with a pharmaceutical company, starting with Searle and ending up with Pfizer. And I've also done research at the NIH, doing clinical research and drug development for all the entire career. And right now I'm semi-retired and working for Northwestern University Institutional Review Board, reviewing medical clinical trials. I came to be involved with the Moderna trial because I've always been interested in clinical trials, obviously because of my background, but also I wanted to participate to sort of give something back to the community in terms of personal experience and understanding that more than anything else, they've been asking for older Black subjects or patients or individuals to be in the clinical trials. So when I found out about the clinical trials last summer, I think I found out simply by Googling clinical trials, clinical vaccine trials, Chicago, and came up with the Moderna trial, which is being run out of the University of Illinois downtown. I contacted them, and a week later they responded, asked me about my background, my health status, et cetera, and if I would be willing to be in the trial, and I said yes. About a week later, I went down to the clinical trial site run by Dr. Novak and Associates at the University of Illinois, and had my first session with them, which involved a physical examination, reviewing the informed consent process, and answering any questions that I might have about the trial. some blood tests. The nasal swab for the vaccine was done. And when all that was done, I got my first injection. It was like any other injection for people who've had vaccines before, whether it's for flu or pneumovax or whatever. A simple shot in the arm, kept an eye on me for half an hour to make sure I didn't have an acute reaction. Then I was able to go home. The next step was to come, they followed up with, they gave me an electronic diary for my cell phone. And every day I would fill out the 7 or 8 questions on the electronic diary just to see how I was doing, if there had been any reactions to the shot, etc. And then 1 month after the original shot, I went back to get my second one, went through the whole process again, similar to the first time, and I got my second shot, went home, filled out the diary again on my cell phone for another 7 days, and that was it for the start. Now, part of the process of being in the clinical trial is you have to be pretty aware of any symptoms you may have, either what you think is a reaction to the shot, or if you think you might be coming down with COVID-type symptoms. So you have to be pretty aware of that, and you have to call up the study staff when you think you might be coming down with something. Just a couple of weeks ago, I thought I might be coming down with something. I got in touch with the study staff. They gave me instructions on how to follow up. They sent out a medical van, did an exam in the van out in front of my house, so I didn't have to go back downtown, and drew some more samples, etc., which came back a few days later. Unfortunately, they were all negative. So I did not come down with a episode of COVID-19 so far on the trial, and it's been about since the beginning of September when I got my first shot until now. So it's been almost 6 months. The original plan was for the trial to last for 2 years of observation. With every 3 months, they would contact me and ask me how I'm doing, etc. And that would go on for 2 years, because the idea is they want to know how long the effect may last from the shot, and any other safety issues that may come after a while. So the original plan was for 2 years follow-up. I think now that the drugs or the vaccines are being approved, they may shorten that follow-up period, but it hasn't been determined directly yet how that process will unfold. So I don't think they'll be following me for 2 more years. At some point, I'll find out whether I got the placebo or the vaccine. I don't know which. I have my suspicions, but I don't know for sure. And in fact, the staff at the center where I got my shots, they don't know either. The only ones who know who got what are the folks at Moderna, who have the sort of code as to what kind of treatment people received. So I'm still in the blind. I'm still blind about what I got. But I'm hoping I did get the vaccine, the active one, but we'll have to wait and see.
Right. And so that because it's a blind study and you don't know if you got a placebo or the actual vaccination, that's why, again, if you're developing any symptoms, you have to reach back out immediately to the team. And it shouldn't be that, anybody thinks, oh, he had the symptoms, even though he was tested and he didn't have it, that, the vaccine doesn't work. I mean, can you talk, Dr. Hubbard, just as a scientist, particularly, and somebody who has worked in this field your whole career, about whether we ought to, can rely on these types of, studies that are being done? Because I know there's some people that do have some concerns because of the accelerated pace in which we're doing these. We certainly here in Evanston, want people to have faith and trust in what is approved by, the FDA, and that we are going to be bringing here locally. So I just like your thoughts on that.
Yeah, I think there's been a lot of concern about the speed with which the vaccines were developed. and tested. It's ordinarily something that takes a number of years. But in truth, the platform technologies on which these vaccines are based have been developed over the last 10 years. So it's all telescoped into the final 1-year period, but the technologies, et cetera, have been worked on by scientists for at least 10 years. And they started being worked on with the SARS episode of 10 years ago when people were concerned that there might be a new viral outbreak. So that's when the technologies were first used. And now the same platforms are used for this. I think it was helpful, very helpful, that we got the genetic code for the virus, which helped us very much do things faster than we ordinarily would have. And using a new technique, this mRNA technique, also made it easier and faster to develop a type of treatment. Now, whether the public can trust this kind of approach, I think I certainly trusted it, or I wouldn't have put myself in the position of going into the clinical trial. I know very well how research works, and I know the companies that are doing the research have good reputations and good scientific procedures as to how to do this. And I have ultimate faith in the FDA as far as how they are evaluating this information. Sometimes it appears as though all we know is from a press release, and that's regrettable. But I was just reading through the 150 pages of the FDA's summary of the Pfizer vaccine, and it's very thorough, and I'm sure that information, well, it's available on the website. So anybody who wants to know in detail about the safety and effectiveness of the vaccine, you can go onto the FDA website and see the information on your own without the filter of a press release. So I think the process, well, it seems to be a bit mysterious for much of the time. The information will be made available, and the decision about whether the vaccines are effective and safe will be, I think, transparent to everybody once that information is released. And in the Pfizer case, it was released yesterday, and it will be discussed by the FDA tomorrow. And I think by Friday, you'll have a decision. So I think we can all feel comfortable that the decision is made based upon the science and the evidence. And despite all the political noise about this, I don't think that's going to have any impact at all about the decision as to whether the vaccines are useful.
Thank you, Doctor. I have a lot of faith and confidence in Dr. Fauci and also these independent, regulatory authorities, and the fact that, there are other countries who are very developed countries like England, like Canada, that are putting these vaccines through their process, makes me feel better. I will remind everybody what Dr. Fauci said on a conference call that I was on, and all these other mayors from across the country a while back, is he said, the risk that we are taking here in the United States with vaccine development is not a risk of human safety. I am not going to let that happen, Dr. Fauci said. He said, what we are risking is we're risking billions and billions of dollars that we are putting into this program to see if we can accelerate the development, fast enough, but still safe to get it out to the public. And he said, and this was back in the summer when we were on this call, and he said, if we're lucky and we get a couple breaks and everything, we will have a vaccine hopefully in January or February. If we don't get those breaks and everything else, it may not be until September or October. And so, it looks like right now, if we get FDA approval, we could see it within the next week being approved here in the United States. But I just want to share again with people what Dr. Fauci said to me and hundreds of other mayors, on this conference call. We've got lots of questions that people are submitting, and please do that if you're on Facebook Live. So we're going to now hit the questions. Let's try to get through them. We've got a lot of questions, so I'd like to try to get them answered. We've got about 35 more minutes. So Ike, let's start off with you first. How is the city preparing and planning for vaccine distribution?
Absolutely. So for months, the city has been preparing for mass vaccination of our residents and, of course, staff. And what that entails is taking a look at the recommendations and, of course, collaborating with CDC, IDPH, and, of course, our community partners who will, of course, help and aid in our vaccination plans. And what actually has also happened is that we are revising as information reaches us. As we know, this is ever evolving, and we are updating our vaccination plans with the latest developments and the pieces of information. But the vaccination plan that we have developed covers an aspect of strategies ranging from transportation, storage, administration, distribution, and of course reporting. And it does take a lot of work to work through the kinks of this, given that the information is always changing. So we are keeping updates with the state, with CDC, collaborating with them in regards to our vaccination plan. And I know there have been questions directed to me and staff, and perhaps you, Mayor, as to who is going to be getting these vaccines. And it is in the news, given that we do have some priority groups who will be getting the vaccine first before it goes to the general public. The general public will eventually, of course, get these vaccines, but the focus right now will be those who are the most impacted by COVID-19, and of course, our frontline staff, which of course are healthcare workers. But these are items that we are still flushing out so that we are pretty much in line with the CDC guidance and IDPH guidance so that we can tailor our plans to remain in the confines of those guidance and recommendations. But there'll be more information to come in regards to our vaccination plan that we plan to share with the general public so that they are aware.
Thank you, Ike. And I just want the general public to know, you have my word and the city manager who's not here with us today, but that we are going to continue to try and share information as quickly as we have good information to share with the public. And I know, again, many people are anxious about finding out how vaccines distribution will occur, what the priorities will be here, and everything else. We don't have those specifics right now, but I think you can look at what other countries are doing, just like Ike said, with healthcare professionals first, those most at risk second, and think we're going to see something similar here in Evanston. Dr. Hubbard, we had a question for you. Sue, who's watching, asked, have you been staying at home? If so, how do they know if the vaccine worked or if you just never contacted somebody with COVID-19?
I have been staying at home for the most part, although I do go out, consistent with, I think, Governor Pritzker's recommendations about sheltering at home appropriately. But I go shopping. For a while, I was going to my local health club, the gym. I walk the dog every day. I have minimized or reduced the number of social interactions I have, and I think all of us probably have. I wear a mask, I do social distancing when I go out. So the only way to know if the vaccine is working or if it's just my being a careful person is to do a clinical study where you have thousands of people living their daily lives. And the law of averages or the law of just sheer number of people will give you an answer. An individual answer, I can't tell you whether. I can't tell you whether my being careful.
I was going to say.
I'm sorry. What was that?
I
No,
think
the video paused, and I was trying to also ask you another question. Can you talk, as both a scientist and someone in this study, about efficacy rates and what that means? Because, like you said, there are thousands of people participating, and they do, in a sense, want you to follow the rules that are going on that we're all following, but they also want you to go about sort of living your life as well, I believe.
Yeah, they want us to live our lives as we normally would. And the effectiveness rate that we have seen is based on a small number of infections. Really, in the 40,000 person trial, they're reporting, at least Pfizer's reporting, that their data is based upon about 150 infections only of the 40,000 people who are in the study. And of those limited number of infections, 95% of which, let me just say, 95% of the infections occurred outside of the people who got the vaccine. So that's where they get the infection rate, the effectiveness rate of 95%. So the people who got the vaccine, only 5% of them had anything that was symptomatic. And I believe there was only one serious infection among people who got the vaccine. So that's where they get the effectiveness rate. It's important to understand that they're not it's not based upon all 40,000 people. It's based upon the 95 or 150 or so who actually got an infection and how effective it was in preventing the infection in those people who were so impacted.
Thank you for that explanation.
It's a little bit hard to understand, but it's based on a small number of people who actually did get infected.
Mm-hmm, mm-hmm.
And that's why the trials have to be so large in order to get us a reasonable number of symptomatic infections to make a scientific basis on.
Indeed. Thank you for that. Ike, we have a question from Renee. And again, some of these questions will be vaccine related, some will not be. So we're just going to try and get through them. I want to try and get through them fast so we can get people's answered. She appreciates you and your office holding the drive-through flu shots that we had this year. We did make a big effort to try and get more people flu shots this year, which means less people hopefully in the hospital come the winter. So our hospitals are free to take care of those who have COVID-19. She asked, will there be a similar drive-through event for COVID-19 vaccinations?
Yeah, absolutely. We are exploring all options at this point. We are looking into having some indoor events, outdoor events, and we haven't ruled out drive-through events because they were very instrumental in getting people vaccinated or tested. So we are looking at what would be the most feasible. And of course, part of our plans, it will be including drive-through testing. But it will also depend on the month in which we get these vaccines for the general public. If it's in the dead of the winter, we will have to choose an indoor option. But if the weather improves and the weather is conducive, we can certainly have a drive-through event.
All right. So all mechanisms are still on the table in terms of how we might vaccinate people here. Okay. We had a question from Fred. I'm going to ask you, Ike, because I think Dr. Hubbard has talked about this a little. So let me ask you this question. How safe are the Pfizer and the Moderna vaccines? Fred wants to know.
Right, absolutely. And as Dr. Hubbard was elaborating and explaining the efficacy of the vaccines, when it comes to the Pfizer vaccine, it has an efficacy of about 95%. Moderna, they are reporting about 94.5, which is pretty much almost the same, which I believe will be very keen for individuals to consider to say, okay, well, if it's providing this much of efficacy and effectiveness, I'll be able to see that, of course, they've gone through all these trials, and I'll feel more confident and comfortable to take these vaccines. So the vaccines has gone through a number of trials, although it has been spared, it has been accelerated, but we believe that the product that will be manufactured, and once it's approved, that it will be safe for the general public to have those vaccines administered. And it is something, of course, that we will encourage strongly for the general public to consider, just based on the percentages. The percentages at this point is very, very promising. I remember when they were still in the process, where they were saying it was about 50% efficacy. I don't know if most people will be encouraged to take the vaccine if you say it's 50%, but at 94%, 95%, I think people will be more keen to take the vaccine. So we're very, very confident. And of course, people are asking what the long-term care, the long-term effects will be in regards to this vaccine. It is yet to be seen. They have indicated a number of symptoms that might be associated, or a number of health effects that might be associated with the vaccine, which might be fatigue, might be headaches, might be just the pain that you get when you take the vaccine. But with any vaccine that you take, there are these effects with them. So we will certainly encourage, and we will have a campaign to rally and get people to our vaccination events, because this is very important.
Yeah. If they said, Ike, that mayors are going to be first, can be in line first, I'd be the first one up there. I'm ready. I'm ready for this vaccine. Absolutely. I have a lot of faith again and trust in all of the different independent regulatory bodies that are going to make decisions. We did have a question from Rosalie, and I'm going to ask Rick real briefly if you can just share a perspective on this, particularly given your past as a scientist and everything. She says, how confident are you that the current federal administration has not influenced FDA appointees to greenlight the vaccine despite possible problems? So you don't have any insight into the current probably administration and things like that, but as somebody who's been in this field for decades, how independent are these bodies like FDA and others to making approvals on food or drugs or other things?
So I do have some direct experience with the FDA. I've been on a couple advisory committees when I was developing drugs, and I know how the scientists are chosen, and I have no question about the scientific independence of the people who are making the decisions. I've also had experience with some of the other agencies in France and in Europe and in Canada, and they go through the same process. And when all of those agencies independently come to pretty much the same conclusion, I think that also gives us more comfort that it's a science-based decision and not a political-based decision. So there's a lot of noise about getting these things done quickly, and I think the scientists are going to be independent about this, and they will do their best because they are charged with doing that, and they want to make sure there's no mistakes made that can impact the health of a lot of people who are going to get these.
Thank you. Ike, anything you want to add to that?
No.
All right, we got plenty of other questions. Let's go with this. I'm going to ask this of Rick, if he has a sense, because I think he's been looking at the different vaccines as well. What is known? This is from Charles. What is known at this point about the various reactions that exist to different vaccines?
It's hard to know. I only know what they said about the Moderna one and the Pfizer one. And as far as I can tell, the vaccine reactions are about the same as you would get with any other vaccine. You get a sore shoulder sometimes where the shot was given. You may get a headache, a fever for a day or so. These things are all self-limiting, and they're just typical of any vaccine that you would get. Even though the technology is new and different, there's every reason to believe it's equally, or if not safer than the older vaccines we're more familiar with. These vaccines, the Pfizer and the Moderna ones, are giving instructions to your cell to make to react in the presence of the virus. So it's instructing the cell, here, if you see a virus, here's what you should do. It's almost like Apple or Google sending instructions to your computer to work on, to recognize viruses and to block them out. So I think it's very safe. The reactions are minor. They can be uncomfortable for a day or so. I'm not aware, but I haven't seen all the data. I'm not aware of anyone having a serious reaction to the vaccine.
Thank you. We've got a couple questions from Sheila. Ike, I'm going to ask if you want to take the first shot at these. First question from Sheila: is the COVID-19 vaccine recommended for people with autoimmune disease?
Yeah, that's a loaded question. As it stands, we have these vaccines, and of course, it is something that is recommended. But also, we are going to wait and see. I know there have been some talks about whether someone who gets the vaccination will be able to still spread the virus, and that's actually a possibility. So we'll continue to see the norm of wearing face coverings and social distancing, even with individuals who have been vaccinated. So when it comes to autoimmune diseases and whether that person can be vaccinated, I think there's still research on the way, just for the researchers and the medical experts and the public health experts to really get a grasp of what this vaccine can possibly do. And as we know, it is novel, it is new, it's not like anything that we've seen before. So there are still a number of questions that are still lingering that needs answers to. And I believe that will be one of those as well. But as it stands, and as you perhaps know, Mayor, the participants for the trials were, of course, adults. And I know there were some questions about, the children and what have you. But they weren't those that were included in the trial. So there's just a number of unknowns in that regard, and maybe Dr. Hubbard has more to add to that regard.
Go ahead, Rick.
Yeah, with regard to underlying diseases, people with underlying diseases were encouraged to participate in the study. So if you had an autoimmune disease, that was not an exclusion criteria. So there probably were some people who received the vaccine who may have an autoimmune disease. We don't know yet until the blind is broken and all that data is released. We don't know yet. But they certainly, there are people who were evaluated who did have underlying diseases. And when the full data is released from, say, 75,000 individuals, I think we'll get a better idea. But those people were not excluded from the trials, and so there will be data available.
Thank you. I would just add that, again, this is all moving very quickly. There are going to be specific questions that many people have, and that these medical questions should absolutely be directed to your medical doctor. For these. And they, again, all of the medical profession are getting up to speed on these as well, just like all of us are, but they get to see more of the research and everything else than the average person probably does. Another last question from Sheila. Ike, if a household member has a compromised immune system, should other members of the household quarantine themselves after being vaccinated?
So that's a good question. When it comes to the vaccine, as I mentioned, it's novel. We are still learning about the disease, learning about the vaccine. But I don't see at this point CDC relaxing any of the preventative protocols or abandoning any of the protocols that we've been using throughout the pandemic, which is, of course, quarantine and making sure that you're wearing your face coverings when you're within 6 feet of individuals, and of course hand washing and staying home while you're sick. So I don't think that they will be relaxing those recommendations. So when it comes to quarantine, I believe even though you are vaccinated, there's still a possibility for you to spread the virus. So in that regard, it will still be encouraged. It will still be a recommendation that we continue to apply these methods that we've been using throughout the pandemic, even when we get vaccinated. And until we gather as much information as possible to see if people are able to confidently state that they've gotten the disease even when someone has been vaccinated. But as it stands right now, the recommendation would be, to continue to follow those preventative measures that we have been following ever since, which is, of course, including quarantine.
Yeah.
And staying away from people who are not within 6 feet from your vicinity. So those will still be applicable.
I've read some articles recently that have made that very clear, that public health protocols aren't going to go by the wayside just because we start to vaccinate people. You'll still, even if vaccinated, be expected to wear a mask and all of that. Just remember, what we're trying to do with this virus is we're trying to smother it. We're trying to basically not give this virus an opportunity to jump from person to person. And when it has no place to go, it sort of doesn't have any place to go. And that's how you either eradicate these altogether or really contain them in a much more manageable way.
Absolutely. And vaccines is just one of those tools to use to subdue, limit, or entirely remove the virus. So those public health protocols, we cannot emphasize enough. Those still need to be in place, even with the vaccine that it is in the horizon. So people need to understand that. Getting the vaccine, of course, you're protecting yourself, but there's still that possibility of you being able to spread the virus to others. So I just want people to make note of that.
Thank you, Ike. I'm looking at the questions. We have some that are really, really technical that I don't think we have the answers for right now, so I'm not even going to pose them. But in a future coronavirus Q&A, as we learn more information, I may ask them at that point. We have a question from Betty, who says, my husband and I are in our 70s and are temporarily living in Las Vegas. Will we have to return to Evanston to get a vaccine? I think this is a really great question, because I know there are other Evanstonians who right now are living someplace else.
It is an excellent question. In that regard, we are expecting for the vaccines to be available at our pharmacies, at medical providers, you name it, that anyone can access these vaccines anywhere in the country. The first batch of vaccines, of course, are going to be limited, and those are going to go to some priority groups. But throughout 2021, there will be ample vaccines available so that anyone can go to like these places I mentioned to get vaccinated.
In Betty's case, let's just take Betty and her husband's case. They're in their 70s. Let's say that the priorities go healthcare professionals and then, older Americans. Betty and her husband fall into that category, but they're out in Las Vegas.
I
would think that they would be able to get it out there, but I don't know how. Yeah.
It depends on the plans that they have in place in Las Vegas, if they will fall in that priority group. But I am thinking that most jurisdictions will be following the CDC guidelines of prioritizing various groups, so that those individuals who are in Las Vegas can get the vaccine that they need. But it all depends on what strategies and methods that they have in that Las Vegas. But given their age and if there are any medical conditions that they might be experiencing, they will be, of course, prioritized, but they might not fall into the tier 1 priority group. They might fall into the third priority group, but they will be able to get the vaccines when those vaccines are made available for that particular group.
Okay. I got a question from Suzanne. I'm going to turn to you and Dr. Hubbard on this to see if you know. If you don't know the answer, just go ahead and say it. She asks, do the Pfizer and Moderna vaccines prevent asymptomatic transmission? If not, how long until nasal vaccines become available, which could potentially solve this problem?
I don't know about the development of nasal vaccines. I know that I think people are working on them, but I have no idea about when they might be available. As far as transmission of asymptomatic, I don't think we know the answer to that yet. I'm sure the data is being looked at, but I don't know the answer, and I think probably we won't know until the full evaluation by the FDA and other agencies has occurred. So I just don't know.
That is consistent with what I have read as well, and one of the reasons why the public health authorities are clear that even though we're going to start to vaccinate soon, the public health protocols of social distancing, wearing a mask, all of that is still going to apply because they don't know enough yet about the asymptomatic transmission of this.
Right.
Okay. Ike, do you have anything you want to add on that? Or I'm going to go to the next question from Suzanne. Are there, and again, some of these I don't know if we're going to know the answers to yet, because she asked, are there any long-term safety concerns with the vaccines?
Well,
Yeah, that's it's a big question. I mean, the longest people have been observed having gotten one of the leading vaccines is probably under a year. The FDA had required that they wouldn't consider any vaccine that had less than 2 months exposure data. 2 months is pretty short. So that's one of the reasons why originally when I signed up for the study, they said we're going to evaluate you for 2 years to see if there are any long-term effects. So the answer is they don't know yet. It's unlikely. But again, the data is still out there and hasn't been developed yet.
Thank you, Dr. Hubbard. Will the COVID-19 vaccine vary in effectiveness season to season, like the flu vaccine does? Dr. Hubbard, do you want to take the first crack at that one?
Again, we probably don't know yet. We don't know if there's a seasonality to this. It's suspected that, like most respiratory viruses, they are more prevalent in the cold weather months than in the warm weather months. The thing about the flu vaccine, though, why it's a little bit different is that it mutates very quickly. So the flu vaccine the flu that you get this year may not be the same bug that's going around next year or last year because there's mutations, and that's why you have to get an annual flu shot, because the flu shot is going to be a little different based upon how the bug is mutated. With regard to COVID, it's a respiratory virus, so chances are it'll be a bit more prevalent in the winter than in the summer. But it may not be that you need to get a shot every year because the virus doesn't mutate and your immunity may be long lasting. Again, it's a little early to say.
The coronavirus, I think this is important, and I don't know if I know the answer. I think I do, but I'm not sure. The coronavirus in COVID-19 is part of a family. I'm just a non-medical term I'm going to use, is part of a family of viruses that we and scientists have been studying for quite some time. Is that correct? I mean, the SARS, H1N1, all of those. And so, again, while it's novel and they haven't seen this, it comes from a family that they're familiar with. Is that fair?
Yeah, that is absolutely true. It does come from a family of coronaviruses, and that's where you have SARS and MERS, and of course the COVID-19. And when we were responding to COVID early in the pandemic, we were pretty much following the recommendations that were established for MERS and of course SARS, because they pretty much are in that same family, and the way that they transmit the virus is pretty much in the same fashion. So you are correct. They are within the same family, but of course they do have variations and they do have different strains. But this particular strain, this particular virus has been a virus that we have not experienced before. And that's why it has been quite difficult. And of course, when you're talking about vaccines, we were talking about the flu vaccine with H1N1, we were able to establish or have a vaccine because it is a virus that we have dealt with before, though the strain might have been a bit different, but we already had that vaccine in place. With this particular virus and the strain, we have not experienced it before. No vaccines have been licensed, no vaccines have been manufactured or licensed to deal with this particular virus. And that's why it has been taking quite a long time to develop a specific vaccine for this particular virus. And as you remember, with H1N1, we were able to secure a vaccine within a matter of months, right? Because we already had the annual flu vaccine that is quite similar to that new strain of H1N1, so that people got vaccinated early enough. So I think that, I don't know if I was able to address that question there, but yes, you're right. They do fall within the coronavirus family. This COVID-19 falls within that family, but with that family, you also have other coronavirus. Even the common cold that you experience also falls within that family. I don't know if Dr. Hubbard has anything to add to that.
No, I agree. It's part of a family, and you can see what the family in general does with regard to seasonality, and you can expect that this one will behave pretty much like the others. But again, because it's novel, it's new, we just don't have enough information to say that with certainty.
I guess my point in asking that question was my level of confidence in the work that is being done by scientists and these regulatory bodies and all of that is elevated, is increased, because it's not like this is an entirely new virus of a family they're not even familiar with. Like, we're familiar with the family. We've been studying the family for a long time, and there's something different about this one. We haven't seen that before, but you know, we have a foundation of knowledge that we are working off and building off of when we're treating it. Although that was been really problematic, we're getting better at treating it, but certainly when we're creating a vaccine. So I think we're about up on our hour. There was one more question that Suzanne had, but I think we've talked about, I think Dr. Hubbard answered this. She asked, will the Pfizer vaccine trial results be made public? Moderna, Pfizer, correct me if I'm wrong, but you said that they would be made public at some point, but that won't be until the trials are completely, done. I mean, their concern is, how can we trust the company's press releases, which is all we're seeing right now. I don't know if you want to just end with that one, Dr. Hubbard.
Yeah, my understanding is that the FDA will publish the data on their website, and it won't be in the form of a press release. It will probably be a rather dense scientific document. So it will be available at some point, and probably pretty soon. And I'm sure that both Pfizer and Moderna will want to have a peer-reviewed article come out in a leading medical journal summarizing the data as well. So, yeah, I know at the moment all we see are press releases, but I'm confident that at some point in the not-too-distant future, we'll have the available data in primary form to look at, should we so choose.
And I would add that all of the regulatory bodies, whether they're in the United States or they're in Europe or other countries, are getting the data. They are able to look at the data, able to look at exactly how these studies were, crafted and implemented in all of that. So the decisions made by these regulatory bodies are not being made off of press releases or anything like that. It's being made off of data and science and expert opinion of people like Dr. Hubbard, who's sat on some of those committees, and others similarly. So I want to thank everyone for joining us. I know this is a timely topic. I know it's a topic that we will continue to talk about in the months ahead as we get more information. As I mentioned in the show, once we have a good understanding of exactly, what the rules are going to be that come down from CDC to the Illinois Department of Public Health to our our local Department of Public Health. We are going to get that information out to the public. I would just ask everyone to continue to follow the public health protocols. Recognize that our numbers are up as they are around the country. Wear a mask, socially distance. Don't go out if you are not feeling well. Be safe for your family, be safe for your community. Thank you, Dr. Hubbard, for joining us today and for participating in the trial. I know it means to Evanstonians to know that we had someone in our own community who was part of that. Thank you, Ike Ogbo, for all of your leadership. I will say on behalf of someone who's not in the public health arena that in 2020, it's a year that we have developed a deep, deep appreciation for all essential workers and for scientists and for public health departments and officials, which I think a lot of people probably had no idea what does a public health department exactly do and why are we spending this money on them. We are so appreciative for what you all have done and are doing to help us get out of this. We will do one more coronavirus Q&A this month. It's going to be focused on our mental health, which is just as important as our physical health and taking care of one another. So we're going to bring that later this month. Thank you for joining us. Have a wonderful weekend ahead. Bye, everyone.